This conference will now be recorded.
Welcome in, everybody. We're going to be talking about bleeding control, specifically utilizing a tourniquet application for a substantial arterial bleed. So I identified my patient when I was going through my general impression and walking up to the patient. I noticed an immediate life threat, and that was substantial bleeding. So we're going to say that this individual did self-harm and severed their radial artery. I'm seeing that bright red blood coming out. I need to control that bleed prior to this individual going into decompensated shock and or irreversible shock. Pre-made tourniquet. This is the cat style tourniquet. So you notice that you got the Velcro strap, you got a D-ring, you got the windlass, you got a Velcro strap to go ahead and secure it. Best practice to always have that Velcro strap go through both sides of that D-ring. Proper tourniquet application, we want to always go high. That is based on military research that they've come across. So with an arm like this, I identified that major bleed. I got my BSI on. My scene is safe. Go ahead and secure your tourniquet. So cinch it down. Make sure that it is nice and tight. Okay, now we're going to go ahead and twist this windlass until the bleeding has stopped. Then within this little channel, I can go ahead and secure my windlass and then Velcro it into place. And then just be mindful of the tail that you're going to leave off. Make sure that you are documenting the time as far as how high you want to place that tourniquet. I want to make sure that I have enough room on that arm to go ahead and place another tourniquet in the event that we start bleeding again. So I'm going to tighten this until the bleeding is stopped, and I'm going to check CMS. And I want to ensure that I am not actually getting CMS at the distal portion of the extremity, because that is the entire premise behind the tourniquet application, is the fact that I am cutting off circulation in order to stop blood flow from that patient's arm. Now we will be utilizing the same exact technique for a lower extremity severe bleed. I arrive on scene. I have a 37-year-old male patient involved in a chainsaw accident. So what I'm going to do, I'm going to take the ESI, I'm going to ensure that that scene is safe. Approach my patient, conduct my primary assessment, and be mindful of how many patients you have, any additional resources that you may need, advanced life support, and then especially with any type of severe trauma, make sure that we're getting life flight activated. So I got my tourniquet here again. I got both ends through that D-ring. My windlass is ready to go. I have a substantial bleeding that's coming just right above the knee. So I'm going to go ahead, loop that through. If I can't loop it through, I'm going to have to remove the Velcro strap, go around that patient's leg, and then put that D-ring back together. Nice and high. Do a couple of good twists like that in order to cinch it down. Go ahead, twist your windlass until bleeding has stopped. If bleeding has stopped, secure it, document the time, check your bleeding site, make sure that it is done bleeding, and then check for a pulse and sensation. Make sure that we are actually no longer able to feel a pulse in the distal portion. Now with tourniquet application, we need to ensure that that stays tight. And you notice that how tight it is on this, that the skin and the tissues around that tourniquet actually begin to sink in on itself. So it might sink in so much because there's so much pressure built up that it might start bleeding again. So reassessment of your patient, obviously this should be done every 5 minutes because this is classified as a critical patient. So if I notice that it starts bleeding again, I'm going to remove this strap and then I'm going to tighten down my windlass again. until that bleeding is controlled. If I tighten it down and it's still bleeding, this is when I'm going to go ahead and apply another tourniquet above that tourniquet application in order to control that bleeding. That does it for tourniquet application. As far as when you should be utilizing tourniquets, err on the side of caution. If you come up on scene, you have a major arterial bleed, you have an amputation, you have a severe avulsion with a lot of bleeding going on, go ahead and throw that tourniquet on. Okay? There's a lot of research out there indicating that we can utilize a tourniquet on an extremity for right around 8 hours without any cellular death. So that does it for tourniquets. Thanks, everybody.